Okay. And I also have some questions that I know they do ask because
Oh,
so for this hospital, they make you pre-record an interview, like when you apply, it's like automatic. So it kind of took me
let's go
from,
through those.
okay. I know it's kind of cheesy, but I like to say that nursing chose me because there was never one moment in my life where I kind of was like, I'm going into nursing. I always knew from the very beginning that I was going to nursing. I had my blinders on, I was going straight for nursing. My grandma was a nurse for 50 years and my mom worked in women's health. So I was always surrounded by that. And I've always been intrigued to help care for things and even like little animals that I know probably didn't need my help. But I've always had that sense of nurturing and to giving like parts of myself to things that need help. So I've always felt that calling. And shoot, I forgot. Sorry. I'm sorry. Um, yeah, and then so straight out of high school, I got my CNA and I was working in a nursing home. And that
Wait,
definitely
is this on Zoom or is this in person?
is in Zoom.
So if you're scared you're gonna forget, you could have bullet points if that helps you.
Yeah. Okay.
Yeah, like helping people, CNA, like whatever.
Okay. I will. Thank you. But yes, I was a CNA and I worked in a nursing home, and that definitely solidified my choice in the nursing field because of the fulfillment I felt every time I was at work and every time that I was able to see the difference in my patient's attitude by just walking into the room and them knowing that I was going to be their CNA for the day. They felt safe and that they were going to be taken care of, excuse me. So that definitely solidified that choice. And then I also was a medical assistant at an urgent care clinic, which was really useful for me because I was able to understand how a unit, like a clinic, functions and how to prioritize my tasks in a way to where it benefits everybody else and the whole clinic flows smoothly. So yeah, and then I just graduated in June and I got my license in August. And I am halfway through my bachelor's program. And I'm really excited to just get started in my career.
I don't want to scare you, but that's often like a red flag. Some of them have a weird hang up of no, our program's really hard. You can't do your program and school.
Hmm.
So it's not unlikely that they will ask questions about that. If they do, don't be thrown off. It doesn't necessarily mean like they're not going to pick you. As long as you have a really good answer of why it is that you think you can do school and a new grad program. So you're halfway through. So when would you finish?
Probably January. Right now, that's because I'm taking 2 classes because I'm not working. So, but it's online. It's really easy. It's just busy work, and I can fly through that. I'm really good at multitasking and kind of prioritizing my time.
So instead of saying you're halfway through, it might be better to say you have just a few months left.
Okay.
Um, and you could even say that the few months left are mostly just sort of busy work type of, or maybe you could say like I want to be fully transparent about how I do have a few months left of my bachelor's program before I'm officially done. All that's left currently is just sort of assignment and busy work. I've already gotten my license because that'll kind of put the kibosh on their worry of, well, she needs to focus on school and our new grad program. It's just going to be too hard. Like nobody can do that.
Okay.
Yeah.
Okay.
Yeah.
To not let them. Okay.
Yeah. I would be surprised if they didn't ask you about it, actually. Yeah. Sorry. So keep going with that. So you got your license and you just finished with the community college and working on the bachelor's.
And I'm just really excited to be able to start my career and hopefully be able to start my career here at such a reputable hospital.
We promote a positive patient and staff experience. Tell us about a time you went the extra mile going above and beyond to meet the needs of your patient or customer. So this one is also one of the most common questions they ask. It's usually like, tell us about a time you went above and beyond, a time you provided compassionate care. this is when you tell like the super heartwarming story where they're like are left with this picture in their mind of you being really sweet with the patient, and they're like, oh my God, we need her. There was a girl who, she told me this story about, it was for a peds interview, and there was a kid who had to wear a helmet and they didn't want to wear a helmet, and she knew they liked cats, so she like worked with the unit secretary to print out little cat stickers and put it on the helmet, and then the kid was open to wearing it and could be in the play area with everybody. That gives you a picture that really sticks with you. Like you want to
Yeah.
tell something like heartwarming for this one.
Okay. She should have got those little helmets with the cat ears, you know?
Yeah.
That would have been so cute. Um, yeah, but okay, so I have a good one because I had a really special connection with this patient. So he actually had, and so he was paralyzed from the neck down, and he had a trach. So to talk to him, you'd have to read his lips. And so a lot of people weren't really like staying in that room because he would take a lot of time. And since I was a nursing student, I gave him a lot of time. I was like, in there most of my day and really like writing on the board, filling out all of his paperwork about like his likes and like about his family. And he was able to share a story to me about his niece and how he missed playing tea time, and that his granddaughter had called him asking about when he's going to come home so that they can have tea time together. And we just shared a special moment. He cried, and I don't know, it just, I can't say I cried, huh? You can't cry
No,
like,
no.
yeah, that's the thing. It's just,
You
I
need to
don't
know the limit of like when you give too much of yourself to where you kind of deplete your stores for all your other patients, or
know.
if you get too attached, it can be really hard to run the code blue on that patient because it's like working on your own family member almost. Like you kind
Okay.
of have to keep some kind of professional level of separation
Okay. Could
for
I
their
say,
own good.
okay, could I say I was able to um FaceTime, like I helped him FaceTime
Yeah.
his daughter because so that they could have tea time together, and I brought
Yeah.
him tea.
Because
So
that's like
that,
when you're telling the story, that's what I'm kind of hoping. I'm hoping you find a way to like, I'm hoping like there's some department that has like extra teacups, or like you're able
yeah.
to like somehow make this tea time thing happen.
Uh-huh. Even though, yeah, I just brought him tea, and then I was able to FaceTime his granddaughter, and she was able to do tea time over. And he just said some really sweet stuff to me afterwards that I was kind of having a rough day that day too with my instructor. So he was just like, you're going to make a wonderful nurse, and every patient you care for is going to be so thankful for you. And it really just stuck with me. And yeah.
Don't say you were having a hard time with your instructor, because they'll be like, why? Like, is she a
Okay.
difficult student, or like what's
Yeah.
um and then bridge it somehow, like while you might not have that much time, especially as a new grad, while you're familiarizing yourself with all the new policies and procedures, you learn just taking even just the time to listen to what their preferences are can make the little things can make like a really big difference. Like, it doesn't take a lot of time. You just listen a little bit, tailor the care towards them, and it can really make them more comfortable when they're having to stay in the hospital.
Okay. That's
Yeah.
perfect.
Yeah. That's really cute. And I like the visual of the tea time.
Yeah.
Stick with them. They'll be like, the tea time girl. She was great. Can you please tell us what made you interested in working here? Why would you like to join our patient-focused culture?
I was first interested because I had a clinical there, and I was really intrigued by how the unit functioned. And I really felt like I was supported in all aspects. And I also know a couple of people who work for us, and they always brag about how well treated they are. And I know our values align with one another. And it really stands for providing compassionate, affordable, and cultural care. And I think that's something that I really tend to focus on, and I really find important in healthcare because that's truly what it's all about. um, I think um,
I mean, if you had just said it like that was your sentence, that would have been perfect.
instead of like ending like question.
Yeah, because when you look at them like, was that good? Am I done? They're like, do I interrupt her? Like, do I? Is it rude for me to just be like, okay, next? You know,
Okay.
they don't really know how to act when you do that. Um,
Oh,
I
and
was
I also, yeah, and I also know, sorry, I forgot to add this in. I is one of, has been rated one of the country's #1 employee satisfied hospitals 6 years in a row now. So I would
wow,
really be honored to be a part of that.
cool. Is there anything like, because I hear you feel like you would be treated really well. Is there anything, and like I loved the piece about that they like to provide excellent care and like culturally tailored care. What about anything of like research or like critical thinking? Like, is there any piece that you could put in that's like makes you sound like you love the nerd part of this?
Yeah, I was going to, but yeah,
Maybe.
I can because they definitely do have that in their mission. But I just sometimes I feel like too like rehearsed and like everyone says that, So I just wanted to put my own twist on it and
Yeah.
just really be on the compassionate side. But if
Yeah.
you think I could do that, I will for sure.
Yeah, we can put in something about that when you talk about why you want nursing, Cares for our patients every day in a responsible and efficient manner. Can you tell us about an improvement you made in your current role and what the outcome was?
So this, sorry, I have a question. This is what I was kind of struggling with because I'm not working. I didn't know what kind of
Oh,
example to give because it says your current, or like, is that me as a student
your
or?
current role. Um, you already mentioned something about what was it as a medical assistant?
Mhm.
What was it that you were talking about with that?
Just my like how I kind of learned how to organize myself and what works for me to be efficient.
So I think what they're just wanting you to speak to like your time management abilities. I don't think it's like a quality improvement project. I think it's about an improvement you made from like kind of struggling in a role and then learning how to be efficient and making sure you not only get your tasks done, but you're still able to have a little bit of built-in time to connect with your patients and make sure that you're looking out for the rest of your teammates as well to kind of help with the flow of the unit when assignments might be uneven and you might need to help.
Okay. Could I maybe say I think it was one of my first times at clinical um where I really like talking to patients. That's like why I love being a CNA. I love just, And so it was a big shock for me when I got into nursing. I was like, oh man, I'm not gonna have time like that to talk to them. And I think my clinical instructor kind of told me like, hey, like you're spending way too much time with that patient. Like you have to like, cut it off at a certain point and then go to your other patients. And so the next time, like every time after that, I made sure like, okay, like to slowly like, back my way out so that I have time for other patients. How do I like put that in a way to answer that question? I could probably say something like, since it was just me rooming the patients, we had 3 rooms in the clinic that, like the physicians and the doctors were waiting for me to room them and get their chief complaint, put all their vitals in. And so if I were spending too much time with a patient, that would back up everyone's flow. So could I say something about me improving in that way?
You could just quickly say something about how when you were an MA, you learned that you had to, you learned quickly that you had to be mindful of how much time you are spending talking with each patient as you were rooming them, because you also had to balance that with the flow of the practice and not backing up care for other patients. So that was something early on that you learned and got really comfortable with, because that makes them feel like it wasn't really an issue. It was just something that you noticed.
Handled it, yeah.
And
Okay.
then you had the same experience when you were a CNA. You really enjoyed talking to the patients and really connecting with them, but you got feedback from your clinical instructor that you do need to learn how to leave a room, so that all your patients get care. And so you were able to use the skills that you had learned as an MA in nursing school to help know how to leave a room, but also make sure that the patient still feels valued and still make time to make that connection with them.
Okay.
Does that make sense?
Yeah,
Yeah.
definitely.
Because it makes it sound like it's something that you've had to get good at. And when you got good at it at the first job, you were able to apply it to the second thing, no problem.
Yeah. Instead of redoing it. Yeah.
Yeah. Honors the dignity of all persons, but sometimes conflicts arise. Please describe a disagreement you had recently with another person at work. How did you handle the situation?
There was this time that I was actually helping another CNA on the floor change this one patient who was known to be difficult throughout the floor. I could tell this CNA was kind of frustrated with the patient. And so while we were changing, they might have said something that they shouldn't have said to them, or just the tone of their voice. And afterwards, I made sure to like talk to her and be like, hey, like, I know like you might be frustrated, but we obviously she's going through something and she doesn't want to be here. So maybe next time we can just go about that in a different way. I just said it in a way that she didn't feel like I was attacking her, and that to make her life easier, because she didn't want like the patient to react to her in a certain way. And I don't think she realized what she said, like how it sounded, to the patient. Like I noticed for sure, but I don't think she realized that she wasn't aware of how it sounded.
Okay. So the language that they use for that in hospitals is what she said and the tone that she used with the patient sort of escalated the situation. And so when it was just us in the hallway, I asked her if she was okay. And I told her that this patient is frustrated that they have to be here and know that it's not personal. And then she might not have been aware that the way she was speaking to the patient was escalating the situation and making her day more difficult, because she could have said it in a way that de-escalated the situation. So like the escalation word is usually what they say about that.
So, okay.
Yeah, so verbiage that they use is like knowing how to de-escalate a situation.
Okay.
Yeah, but that was good. And then you kind of want to frame it as you were checking in on her to make sure she was okay. But I think that's a good example. Is that what you used in your paper thing for them?
I think so. It was either that, or I used an example about a time a nurse who wasn't like, I don't want to talk bad about anyone, especially like a nurse, but she wasn't open to having a student that day. And she made it clear to my instructor, but I still had to be paired with her. So
Yeah.
she's kind of like blowing me off all day. And she actually made a medication error and I caught it. And I like told her, I was like, before she gave the medication, I was like, hey, like, can you do like the dosage like calculation with me? Because I'm not understanding like how you got that. And I'm like student, so obviously I don't know as much as you do. So I would like to hear like and like see how you did it. And she's kind of like, I could tell she's like, what? Like, okay. And then she did it and she's like, oh my gosh, you're right. And because she even got, when she scanned it, it said like
That's
alert,
even,
like,
you should say that one.
yeah, but I feel like it's like not a, is that a conflict or is that just like,
That's a conflict. Yeah. Like
okay,
that's knowing how to speak up when something's unsafe, which is really hard when your position in the power hierarchy of the hospital is at the bottom and you're like, how do I speak up about this without getting like killed? Like,
yeah,
like they're gonna hate me forever, but like
right.
I don't want like this patient to take the fall because I'm too scared to speak up, you know?
Yeah. And she ended up being really like afterwards, she was like thankful for me. Like she was like warmed up to me. I was like, oh, okay. Woo.
Yeah, and just really emphasize, how you wanted to make sure that she felt respected.
That I
Yeah.
wasn't stepping over her and like, hey, like you're doing something wrong. Because it was
Yeah, that you
definitely like,
just,
I don't understand. Like, can you teach me? Because I'm new.
I'd love to learn from you.
Yeah.
Yeah. Yeah, I think that's great. Yeah, and it also shows that you're safe.
Mhm.
You get so many extra bonuses with this one that you wouldn't get with the other one, so I would go with this for sure.
Okay, cool.
Yeah. What's the most valuable lesson you learned during your clinicals that you can apply to your role as a new grad RN?
Um,
You could go anywhere with that. That's so, what do they want from you?
right. That is the question. Could I just say really to like as a new grad, I know I'm going to be stressed, but the number one thing I learned from clinicals is that it's all going to be okay. Like if you take one step at a time, you're going to get to where you need to be.
You could, or so during your interview, especially if it's like a step down or ICU, you should have two stories that you tell of a patient that was not stable, and at the end of the story you were able to like stabilize them. You know, like maybe you noticed they had a facial droop, or they told you they had chest pain, or there was somebody whose vitals weren't great, they were bleeding, and you told the nurse like, hey, this thing's going on, and then you guys did the interventions in a team. So you should have two stories where, because what they'll ask is, tell me about a time you had to think critically, a time you had to act quickly, tell me about your most critical patient and how you stabilized them. Or if they don't ask those things, you find two questions in your interview to pair it with. So really good ones are like a time you advocated for a patient, or like a time you had to think creatively. Or you could use like, what's the most important, like valuable lesson you learned. So you could say like the story of what happened and that you learned, like no matter what, like if you just whatever you said, it was perfect, that you like you will get out okay. So what if can you tell me your two stories, and we can see how we can pair them to different questions for critical. I want them to picture you feeling confident, not just thinking of yourself as like a student, but like as a nurse now, like
Sorry.
you can like escalate things that you can tell are not right, or like at least get the right people in the room and do the interventions with them.
Okay, there was one time and I checked a patient's blood sugar and they were unconscious. They weren't, so I wasn't able to really check by their mentation.
Well, you
But
were though, because they were unconscious. You
they
could
were
say they
like,
were lethargic.
oh, okay.
Yeah. You don't have to say they were
Yeah.
lethargic beforehand.
Okay. Okay. Um, but I checked their blood sugar and they were very hypoglycemic. And so I was able to alert my nurse and we were able to follow the
But give
hypoglycemic
give like a
protocol.
number, because it'll perk up like a nurse brain more to hear like the number than like they were hypoglycemic.
Okay. So it was in the 50s.
Yeah, say that. Because
Okay.
then they'll be like, oh, like they'll be like more like engaged in your story, because their brain's gonna try to like fix it, you know?
Huh. But it was in the 50s. And so I alerted my nurse of it. And we were able to follow the hypoglycemic protocol. And it actually just kept dropping. It like every 10 minutes when we would recheck it, it would just keep dropping. And so we had to get the provider on the phone and tell him what's going on. But unfortunately, so I don't know how to finish this because I wasn't there long enough for the
So
problem to be fixed.
what was your like your protocol? Did you give D50, or did you like,
Yes.
yeah, take credit for that for sure.
Okay. So just say I was giving D50 what? I think it was like every 15 minutes we were checking and it was still low.
Did they end up having to put the patient like on a sugar drip?
The sugar, yeah.
Dextro, what it would be like a dextrose drip.
Hmm.
And that didn't do anything either?
I think it was staying around like the 60s, but it was still
Oh.
like once it gets off, they thought it was going to keep dropping again.
Okay. Yeah, so you would say like, I had a patient that was lethargic. So I checked their blood sugar and it was in the 50s. So I let my nurse know, and we followed the hypoglycemia protocol. So we were checking the blood sugar every 15 minutes, as well as giving D50. Surprisingly, the blood sugar continued to drop. So the patient ended up on a drip as well, to help provide carbohydrates through the IV route continually. And the blood sugar started to hold steady in the 60s. We were surprised it was taking so much to correct it. Unfortunately, I had to leave the clinical site before we were able to get the blood sugar above 100, but it was a really great learning experience of, and then just however you want to wrap it up, of like if you want to go through the bit you said of like when something critical happens, to just remind yourself that you'll be okay, you just escalate appropriately, follow the protocols.
Okay. That's perfect.
Yeah, you could say the patient ended up requiring a D10 drip as well. And then, do you still remember what you said at the beginning? I mean, you have the recording, but you could totally bridge that together.
about saying like it's okay, like just step back and take a deep breath and just focus on what you need to do in the present, and then everything will be okay. Like it'll all work out.
Yeah.
Okay.
You could just say like, you know, to just take a deep breath, take a step back, and just kind of go through your evidence-based protocols of like what is proven to help in these situations, and just calmly follow the procedures and get help, and know that that like, you know, I will be okay, and I'm gonna do whatever I can to help the patient.
Okay.
Yeah. What compliments or feedback did you receive from a patient during your clinicals that left an impact on your practice? This question was made for you. Okay, what do you got?
So do I say the story, or do I just say like,
Yeah, say the story. Give them like the visual image because that's what they remember.
okay, so do you want me to say it? Okay.
Yeah, yeah.
Okay. So I had a patient who had a trach, and so basically he was
Wait, you
paralyzed,
can't tell the same story twice though.
right?
Yeah.
Could I just say
You could
that
say it if they
patient
haven't.
that
What was the other one you used this for? This was
I
the going the extra mile in the
yes.
teacups. Yeah, you gotta pick another one.
Oh man, okay. Um,
What about like your favorite CNA patient? Do you have any like special like things you guys used
oh
to do?
yeah. Yeah. Um, yeah, I have this one patient who, when I was a CNA, who was very particular with her care. And so she always told me how excited she was when she would hear from the night shift CNA that I was going to be on. And she told me, I don't think you understand, well, quote, I don't think you understand how safe I feel when I hear that you're going to be my CNA for the day, because I know I will be taken care of for the day and that I won't have to worry about if I'll get the things that I need. And yeah, that just really, it was hard because it was a time when I was um moving on from being a CNA, so it made me want to stay because I was scared who was going to take care of her, you know? So
I wouldn't say
I'll
that
say that. Yeah, no, I won't. I won't.
because then it's almost like everybody knows that nurse that feels
But
like they're the only ones capable of taking care of the patient, and like
yeah,
it kind of like splits the staff of like the patient really likes this staff but not the other staff, and then it's like it's kind of like unfair and inappropriate to the other staff because now the charge is like, well, they said they don't want Alicia, so we can't assign that because she prefers, you know, Kelsey, so I have to like, it just makes it kind of weird and like inappropriate.
yeah, I understand. Okay, so just stop right there.
Yeah, but the rest of it was beautiful. Like that's exactly what they want to hear,
Okay.
because it shows also that when no one's watching you, you're still going to do the right thing because it's your job and these patients are vulnerable, and like if you don't brush their teeth, who's going to, you know what I mean?
Oh
Yeah.
yeah.
Yeah, you can't teach that either. People either have that or they don't.
Mhm.
Yeah. um okay, what expectations do you have for your new role? how do you how have you prepared to face the challenges that come your way as a new nurse? What does that mean? What expectations do you have? I would think that would, is that like expectations from your preceptors or like what you think your role is going to be like? How have you prepared?
Maybe like how difficult do you think it's going to be, and do you have like a proper like self-care routine and like
Yeah, that's exactly what I was
resources
thinking.
at home like to help you, like, you know?
Yeah.
Well, I already know going into this program that it's gonna probably be one of the hardest things that I'm going to ever do, and I'm ready for that and I'm excited. And I do have really good resources at home. I have a very supportive family who knows what I'm going through, and I love to take my dogs on walks and get fresh air when I'm stressed, and I have a very stable workout routine. I work out in the morning to just relieve myself of all stress and to just kind of focus on what I need to do for the rest of the day. It allows me, I'm so sorry, the dogs.
It's okay.
I'm so sorry. But yeah, could I say something like that to where I have a really like working out is my kind of escape from the world, and walking my dogs outside and just getting fresh air helps me really self-meditate and reset myself when I'm
You could
stressed.
also say like another piece of this could be like making sure you really know who your resources are,
Mhm.
asking for help when you need it.
Oh
You know, if
yeah,
there's something that you don't know how to do, to like know how to look up a policy. You know, the first time you do a procedure, like make sure you ask your preceptor to go with you to see what pointers they have.
definitely.
So I learned like as a new grad, you can't be like, I've never done this before. Can you teach me? Like what they expect is that you like print out the policy and procedure and like highlight it and be like, I have my supplies that it says that I need. Like I've highlighted the steps. Can you just like go with me? Because like especially after you don't have your preceptor anymore and it's just like basically the charge nurse is your support person, they might be like covering breaks, they might like have another patient, like another nurse's patient is in like a rapid response, like they can't always like teach you, you know, knowing who your resources are, like knowing how to look up policies and procedures, and like that helps you kind of manage stress as well. Yeah. um And then the last one is, what was your biggest accomplishment in nursing school that will help you in your role as a new grad RN?
Huh. I my biggest accomplishment in nursing school was that I was able to get straight A's, but I don't know how I can incorporate that.
So maybe this is when you talk about like the nerd part of this, of like the critical thinking and being able to like look at the details of like, you know,
Mhm.
down to like lab work and stuff, but then also keep in mind the big picture of how everything fits together. And like
Okay.
each medication you give, like what will be the effects on different organ systems, and like,
So like basically saying like I'm super like having such good grades throughout nursing school made me super aware of like the finer details of as to why I'm doing certain things and what the possible outcomes of them will be, and how to critically think like that.
yeah, like you can say that like, you know, your initial goal was to get good grades, but like in order to do that you had to really dive deep into like the critical thinking, and like the more that you learned about how different medications can affect different organ systems and how everything works together, like the more you realized that you love learning about that. And that's part of why you want to work on a step down unit, because you're going to get like a lot of opportunity to do that.
How do you think of these things? How like
I've heard a lot of interviews.
oh, I wish I could just so
um I'm a lot better on
hard.
paper too, like when I sometimes when I talk, like how like in my interview I would like start saying stuff and I'd be like, where was I going with this and what was the question that they asked me? Crap. I hope that sounded like cohesive somehow. It was bad
Is
enough
that
where like I would write down like a question that would remind me like what the question even was. Cause like halfway through I'd be like, oh right, they
what
were
was
asking about this.
oh, that's another thing. Can I ask them like in the beginning of the interview, do they mind if I take notes? Because I don't want them to think I'm just like looking down.
It wouldn't, no, because what they're
No.
gonna think is that you're writing down like the questions to like give to your friend who interviews next week or
Oh,
whatever.
okay.
Yeah.
Okay.
Yeah. I would just write down like one word, if anything. Like even if you have to, it'd probably be better not to, but like, yeah.
Okay.
Um, you don't, I've never seen you like forget what I asked you. I don't think
Yeah,
that's a problem that you
I'm
would
just
necessarily.
scared. The
You're
real
not like a rambler either, which is good. um,
it wasn't my patient, but I was rounding like a good nursing student and helping out other nurses in my free time. And one of the male nurses had a Muslim patient. She was female. And I know that in their culture, they're very modest. And she actually needed a Foley, and I never had done a Foley. So I was super excited to hear that. And so I let my nurse, who was a female, know that, hey, like maybe we can switch one of our assignments with him so that we can do her Foley, because I know modesty is a big deal. And so we ended up being able to switch like a wound care, one of our wound cares for his Foley. And it ended up working out really well because she was really thankful. She thanked me. She was really appreciative that like I took the time to notice that, hey, like in their culture, that's not okay, you know?
So say something to bridge it to like what you'll do going forward for every patient.
Okay. So kind of like something along the lines of just taking the time to kind of like make sure.
Or you could say like it was just like a really easy switch for us to make, but it was
A
a really
huge
good
thing for
learning
her.
experience seeing like how a small change like that to make the care more tailored to like the patient's preferences
Hmm.
makes a really big difference for the patient,
Okay.
is what I'll take going forward from that.
Okay.
Yeah, because like what if you have a patient that like is a different culture, like you can't just like swap a male and a female and like have that be, it's got to be something that's like what you learn going forward, like just
Yes.
making small differences based on like really listening and paying attention to their preferences. It actually makes a big difference.
Okay. So, okay, I know. Okay.
Yeah.
For strength, I think one of mine would have to be that I'm very curious. So I always want to know the why behind things, which I think is a huge deal for nurses because we should always know the why behind why we're doing something. And it allows us to stay one step ahead of our patients and to kind of anticipate things. And it also allows us to never stop learning, which we need to because our career is evolving all the time. And for a weakness, I would have to say that I'm probably a big self-critic, and that tends to lead to some negative self-talk. And I know that's poison, that's not good for anyone. So I've done a lot of self-help on myself, like reading books about it and podcasts. And I found that journaling my accomplishments and my goals helps me stay present in my future and what I have done. And it allows me to focus on, yeah, the future and the good I have done.
Just so you know, one thing that I've seen new grads do is at the end of their shift, they write down 3 things that they did really well and 3 things that they want to do differently going forward. And then like that's it. They're
Oh,
not allowed to like ruminate.
so well, yeah.
Yeah. And like they'll be really like quick at like, oh, I did this wrong, this wrong, this wrong. And it's like, but 3 things you did well. And they're like, oh, I don't know. Like, I'm like,
Mm,
come on.
yeah.
They don't want to
Okay.
say it because like it feels weird.
Yeah.
Yeah.
So yeah, journaling definitely helps a lot.
Yeah, you want to, because the way you told it, it almost seems like this is something that you're like still still working on with the weakness. When you tell a weakness, you always want to make it sound like it's something that like you have a tendency for, but because you know that about yourself, you found a way around it.
Hmm.
So you could say, just like frame whatever your process is, just frame it in a way that like this is what I found works for me.
Okay.
Yeah. Is my
Okay.
signal still okay?
Yeah.
Yeah, okay. Um, where do you see yourself in 1 and 5 years?
So in 1 year, I find myself hopefully very confident in my skills and my knowledge and being a part of a unit that runs like a family and is very supportive of one another. And in 5 years, did you say 5 years?
Yeah.
In 5 years, hopefully I'm in a master's program and I'm working towards my nurse practitioner's license. And hopefully I have some type of leadership on the unit, whether it be a charge nurse or just being able to precept other nurses and kind of give them tips on things I wish I would have known as a new grad.
Okay, cool. You can also say that you'd love to be a part of any kind of like committees or like quality improvement projects on the unit.
Okay.
You're for some reason your like video is frozen.
Oh, really?
It's been frozen like this whole answer.
Can you hear me though?
Yeah.
Um,
Your talk. There we go. That works.
okay.
Okay.
Sorry about that.
Um let's see. We have a lot of great candidates. Can you please tell us why we should choose you?
Yeah, so I feel like I'm an excellent candidate because I'm very reliable and I'm a really fast learner. And I thrive in a fast-paced environment where I get to collaborate with members of an interdisciplinary team. And I strive to be a great team member no matter where I am. And I always make sure that every patient I come across feels cared for and seen and not just seen as another patient.
Yeah. Yeah, that's great. Can you please tell us about a mistake that you made in your clinical experiences and how you took accountability for it?
Yes.
A lot of people talk about like putting the wrong label on like a urine collection or like they almost made a med error and then they realize like, oh, I need to like stop and pay attention or like something little like that.
Um, I have one from when I was a medical assistant, like before
Okay.
I learned like this, like the 9 rights, to medication administration and went through nursing school. I was actually giving an injection. There was 2 injections that were the rooms right next to each other, and they both were receiving a Toradol injection. Not that it mattered, but they were labeled um, with their name and date of birth. And I went into the room when I was going to give the injection, and I noticed that it was for the other patient. And I immediately got myself and was like absolutely mortified that I even did that. But it's the same injection. Not that that matters, but it just really made me never made that mistake again. I'm super hard on myself about double checking, triple checking because I never want to make that mistake again.
Yeah.
So I'm kind of glad that happened in a way because now I know I'll never make that mistake again. But I did have this one patient who was so she was very confused and kind of combative, and she tended to say a lot of inappropriate things. But I kind of took this as, hey, she needs extra caring. And so I know she mentioned something about her dogs, and I wanted to kind of bring in her dogs in a way to comfort her. And it definitely did. And she actually, from what right when I talked about her dogs, I just saw her kind of light up like, hey, how do you know about my dogs? And from there on out, it was kind of a way I could de-escalate her and ended up being really helpful because we had to put in an IV on her, and I was just able to kind of talk about her dogs while they were putting in an IV and just able to de-escalate that situation.
Cute. Um and you could maybe because what I'm thinking is like I'm picturing the guy who like I don't know is like violent or like you know how I'm sure you know this, you probably learn it really quickly as a CNA, like what works for one person doesn't work for the other person. You know what I
Oh
mean?
yeah.
Like so you could maybe say
Yeah.
something that speaks to that, how like through your experience working with patients as like a CNA and MA and a nursing assistant, you've learned like what works for one person in terms of de-escalation doesn't always work for another person. So really like taking the time to listen to the things that they talk about and like what they personally care about like helps you in those moments when you really do need to redirect them.
Okay. I like
Yeah.
that.
Yeah. If they say a time you had to be creative or innovative, you could talk about the dog thing. Need you to think creatively. Do you have any other stories that come to mind for that? Every time you had to be innovative or think creatively?
Mm, I don't know if I'll be able to use it because I don't know if we like it was a time a condom cath wasn't sticking on properly.
Okay.
I for- I forgot what we used though, so I don't really want to use that because I don't really remember.
Jerry rigging stuff there too, especially if people have like swollen scrotums, can lead to like pressure injuries, which is
Yeah,
really
that's
hard to explain because you're like, see, what happened was he was peeing
so
everywhere and we got sick of it. So
yeah, I don't want to go there.
um a lot of people talk about like stuff that they had to do differently based on like COVID, like FaceTiming or like that kind of thing.
I mean, could I say about that one patient I FaceTime to get tea if I don't
That's
end up
that's what I was thinking of.
um I feel like I have more, I just can't
They're for
think.
sure gonna ask you that like above and beyond type of thing though.
Yeah.
Yeah.
Mm, to think about that.
Okay. I mean, it's not like a likely question, but yeah, something to think about. If there's like another story that you haven't talked about yet where you did something like a little extra for somebody because that's what you knew would make a difference for them.
Yeah.
Um, let's
Oh, I ended up this one of my patients was really hard of hearing.
uh-huh.
And so I asked the charge nurse if there was like, I don't know, any device that could help. And she ended up getting the little, I don't know what it's like a
Pocket talker?
microphone. And she gets to wear the headphones. And I spoke into the microphone when I would provide care for her.
I think it's called a pocket talker, right?
Pocket talker. Yes, that's
Yeah.
what it is. The pocket talker.
Yeah, and you could talk about like doing little things for people, like making sure you have the board and the marker, like making sure that you don't just give up if there's like a difficulty in communication, that you like help at least go try to find other ways that they're able to communicate so they don't just get frustrated and feel like helpless and alone.
Okay.
Yeah. No, that'd be good. They could ask for like a time that you advocated and you could talk about that patient who had the low blood sugar.
Hmm.
Like you got to find a way to work that clinical story in somehow. What about if they ask for any like leadership positions you've held in the past? This is when you talk about when you like trained other employees or like organized something or like,
Mhm. I would train all of the new employees that come into the urgent care clinic, like the medical assistants. Um, yeah, and I would just teach them how to like navigate through Epic, how to room each patient and what to ask to really get their chief complaint. And um, even I would teach them how to do like little laboratory, little like the urine cultures and stuff like that.
cool. Yeah, that works. And then you could finish it off by saying like you would love in a few years to be able to do something similar like for nursing students or like new grads,
Okay.
that you find it really rewarding. So what if they say those are all the questions that we have for you? What questions do you have for us before we finish? Can you tell me a little bit about the new grad orientation process on the unit?
Okay.
Then that'll tell you like, you'll have one preceptor for 9 weeks, and then we'll have like weekly progress meetings, see how you're doing, or like, yeah. So can you tell me a little bit about what the new grad orientation process looks like on the unit, or if I were to get the job, what would be the best way for me to prepare in the meantime?
Okay.
Um, or you could say like, are there any goals that you're working towards on the unit right now? Any like quality improvement projects that you guys are excited about at the moment?
Get them
Um,
excited to
get them
talk.
get them talking, because then you can send me an email and be like, my interview went great and I drafted up this thank you letter that I want you to look over for me that talks about all this stuff that they talked about. I have a
Okay.
video about like thank you letters. So you talk about like, you basically just make it sound like you like really listened and connected with what they said because you also really value that and you're like so excited and yada yada. It reads a lot better than like, hey, it's me again. Here are all the reasons why I'm the best. Also pick
Yeah.
me, thanks. You could say, could you tell me a little bit about the patient population on the
Yeah.
unit? What disease processes do you guys see a lot of? Because that'll tell you like, is it all trach patients? Is it all like post cath lab patients? Is it like GI surgeries with like a lot of drains and stuff? Is it like spine patients? Like, so did you get a chance to look at the videos I sent you?
Yes.
Yeah, okay. Like I'm happy to say it, but I feel like if you can hear me say it for free, like I don't want to use your minutes on that. So yeah, like if it's something where you're like, what? You can just go through that kind of
Mhm.
process and you'll get like 80% of it right. Um, so it's a step down. So did you see the one about like the 3 patients on the call bell?
Yeah.
Yeah. Okay.
I
So you know about
still-
the prioritization and like the delegation and stuff?
yeah, can you test me though? I want to see if
Yeah.
like okay.
So you have 3 patients who are all on the call bell. The first one uh says that, and this is the patient that came in with chest pain. So they say that they have 10 out of 10 chest pain, and they need help right away. And second patient is the patient that came in with a fall, and they said that they need to have a bowel movement right now. They can't wait. And then the third patient, you can't understand what they're saying because they're not actually making any sense when they talk.
And that's normal or is that a change?
That's a change.
Okay, well then I would definitely assess them first because that's a change. And I would have a nursing assistant or yeah, nursing assistant go check on and help the patient that with a fall to the bathroom and make sure that they can get them there safely. And then I would go assess the patient with chest pain and make sure that it isn't, I mean, it is the same type of chest pain that he's been having. And if there's any like morphine that we can give him, um,
I feel like more
or
standard is like a standing nitro order. So like a
okay,
lot of times what happens is like when you're new, you're like, oh my God, chest pain. I remember the NCLEX. Like this is a huge deal. You'll think the doctor wants an EKG and the full like tropes and everything, but it's like, no, they've had this chest pain like
it's just
repeatedly. So like you'll let the doc, so like you'll take like the blood pressure just to make sure they're like perfusing. And the thing is, if they're already low and then you give them nitro, you'll just like tank their blood pressure. So you need to make sure it's at least, 90 systolic or whatever the
yeah,
parameters are. Um, and you just grab, the PRN nitro and then recheck to see if it resolved their chest pain. Usually the standard is like if 3 doses don't resolve it, then you reach out to the provider. But you can
okay.
always just FYI them, like FYI, patient complaining of 10 out of 10 chest pain, um, ace, like not complaining of any other symptoms, vital signs stable. Um, would you like any other workup or so the way I would say it is I would say like I would first ask the nursing assistant to help the patient that's a fall risk. Um, and then I would ask either the charge nurse or another nurse next to me if they could just go grab vitals real quick on the patient with the chest pain while I just do a really quick neuro assessment on the patient that's not making sense. That way, if it was just, an issue with the call bell or, some like a really easy explanation, I could meet the other nurse in the room, know at least by now that their vital signs are stable, and just go grab the nitro and let the doctor know, make sure there's nothing that's changed. So let's walk through, like, let's say you go into this third patient's room who's not making any sense, and they're also on the floor and they look like they're having trouble breathing.
Okay.
So this is what you walk in and you see.
So I would definitely go probably call for some help as I'm going over to assess them since I'm a new grad and first assess and kind of maybe if it's possible sit them in a position that's helping them breathe, like sit them up if I don't suspect any spinal cord damage or anything, look to see if they have any injuries. And then, so assessing, maybe take some vitals on them while I'm
Okay, yeah.
assessing. I definitely don't want to leave them at all ever. And then if I need it, so there, I'll do a neuro assessment for sure. Maybe check a blood pressure, check their blood pressure and check a blood sugar,
Yeah.
definitely. And then based on whatever assessments I find or whatever I find from that assessment, do
Let's
some
say like all the vitals were normal, but their sats were they were satting like 85. What would you
give them some oxygen, whether it be a face mask or a nasal cannula.
and just say like I would titrate to 92% unless they
Okay.
have COPD.
Okay.
And so you've assessed that they don't have any spinal injury. They just like decided to sit on the floor, like they didn't even fall, like vitals look good, no concern for. And when you say like make sure there's no spinal injury, you can go like this so that they kind of know you're thinking cervical.
Hmm. Okay.
um
Good.
yeah, or you could just say cervical, but like if
Okay.
you like lose the words for it, you can just kind of like assess for any injuries, make sure there's no concern before I move them.
Okay.
So this is where you can also get points for like delegation. So you could say I would ask I would go on the call bell and ask for the nursing assistant to bring the lift equipment to help us get the patient safely back to bed. So then it's like you, the charge, and the nursing assistant, like getting them back to bed. So
Hmm.
usually for us, it's like a hover jack and a hover mat.
Yeah.
But it's different in every hospital. I have no idea what it is. And then you could say, I would also put this patient on rapid responses radar, just in case there was any further escalation of this later in the shift, so that I would at least be familiar with the patient, see if they have any other suggestions. And then I would let the team know, and see if there's any workup that they would want in terms of like imaging or labs, and let them know any changes from baseline that I might have seen in the neuro assessment. And then fill out an incident report about the patient being found on the floor, possible unwitnessed fall.
Yep.
Yeah. Um, I'm like trying to get creative with these, and I feel like I've already given like all the answers on the for like anything I could think of in the videos. So let's say you come in and the patient appears to be asleep and they are like just covered in like blood on the blanket. What would you do?
Call for help, go and assess them, try to find the bleeding wherever it is and stop it. Um, check to see if they have a pulse.
Yeah.
Um, check their blood pressure. Do you want to check their vitals? Hopefully it's not, their blood pressure is not tanking because they're losing that much blood. And then if they need fluids or something, and then let the provider know about the
Yeah,
incident.
another piece that I feel like a lot of new grads miss is like you get to talk to them and ask them, like, see if they're alert and oriented, ask them if they're dizzy, ask them if they have any pain, ask them if this has ever happened before.
Okay.
Yeah, like you get to use them as a resource for like more info. Um, what else? So maybe if it's like a tele floor, like what would you do if you had been like watching the telly for your patient and noticing like each time you look there's like increasing ectopy, like more PVCs,
Mm-hmm.
maybe like some peaked T waves. um
Definitely go and assess the patient and
yeah, or maybe they had like a couple second run of VTAC or something. um yeah, so you would walk in and what would you do?
first ask them if they're feeling any dizziness or any change in mentation or anything like that. If they're getting a headache or they feel short of breath, and then take their vitals and make sure that they are perfusing. Um, and then contact the provider and let them know about the changes in their EKG.
And usually what they'll want is like electrolytes, like see if they want a BMP or an EKG. And then, let them know if the patient is symptomatic. So usually like my page to the provider will say something like, FYI, patient had 6-beat run of VTAC, vital signs stable, asymptomatic.
Mhm.
We do like a BMP. Yeah. Because that'll be their first question. They'll call and be like, are they okay? Like, are they dizzy? Are they in it? Like, you feel dumb if you're like, I don't know, I didn't ask them. Like,
Yeah.
we'll go back in there and ask them.
Yeah.
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 Yeah. What if you went into your patient's room and you are with like you and the nursing assistant were cleaning a patient and the patient started to have a seizure? What would you do?
Definitely protect their head at all costs and slowly. So wait, are they laying down?
Yeah.
Okay, well, I definitely want to turn them to their side so they don't aspirate. And then I'd want to record the onset of the seizure and wait until it's done, right? And then you want to definitely let the provider know the onset and then how long it lasted, and then make sure the patient's okay and check their mentation afterwards. And they need any oxygen.
As soon as it's done, you can take a set of vitals.
Okay.
Oxygen is kind of what you're most focused on, like that, and I guess blood pressure, but like, it's possible that they could like aspirate or they could like bite their tongue and like their airway could, be like,
Oh, yeah.
yeah. Um, and then you could also press the call button and let the charge nurse know, because if this is not the first time, they might have like a standing like Ativan order that they could get for you while you stay with the patient.
Okay.
And then see if they want any workup like EEG or any lab work, um, MRI, like, yeah. Um, okay. Are there any like things like that where you feel like you wouldn't know what to do? Like, are there any things that are like kind of scary and like cloudy for you?
Mm, not that I can think of. I just know I would always like stay with my patient and call for help if if I didn't know what to do.
Vitals, always vitals. No one's
Yeah,
gonna be like,
always
why did you
vitals while I'm
vitals?
waiting. Yeah, while I'm
Yeah.
waiting for someone to come and while I'm with them.
Yeah. And like if it's any kind of like they're lethargic or whatever, they're confused, blood sugar check,
Neuro.
neuro check. So usually like you don't have to say what you would do in a neuro check, but if they grill you, you would say you just like ask, see what their orientation level is, and then ask if they can smile,
Mhm.
see if their face is symmetrical, and then do like the pronator drift where you have them put their arms out and close their eyes and see if one of them drifts. And then usually I'll like be like, um, can you grab, I'll give them my fingers. Can you grab my fingers? Can you pull me towards you, push me away? Um, do a little shoulder shrug. Um, can you pull your toes up towards your face? You put your toes down like you're stepping on a gas pedal. Can you lift this knee, that knee? And are you able to feel which, close your eyes, which foot am I touching? Um, like do you have any numbness or tingling?
Yeah.
They you can also look in their eyes. Um, yeah, I feel like if it was a stroke, like that, all of that would definitely catch it. Yeah, but you don't have to go into all of that. If you say do a neuro check, they're just going to automatically assume you do this way in their mind,
Yeah.
if they do grill you, you can say all of that. um yeah, what definitely be prepared. I'm just kind of going over like overall stuff. Definitely be prepared for them to ask you about the fact that you have to still complete the bachelor's while in a new grad program.
Mhm.
And just, again, tell them you only have a couple months left, and the portion that's left is just sort of like assignments and like busy work type of things.